Okay, we come again. So this is Chanel Codes. Today we are discussing renal failure, one of the conditions that is affecting the urinary system. One of the conditions affecting the urinary system. So before we begin or we start going in details, I would love us to go through the structure of the kidney. The structure of the kidney, though we're not going to talk about everything, but we'll just get some hints about it. So these structures of the kidney that you are seeing, we've got the kidney cortex, we've got the renal column, we've got the pyramid, where we are going to find the nephrons. We have the renal pelvis, in which when urine is formed from the nephrons, it flows in the pelvis, then goes to the ureters. We've got the major calyx, we've got the minor calyx. All these structures are very important for us. We've got the renal vein, the renal artery, the ureters, and the capsule. So these are the structures of the kidney, but what we are going to concentrate much on is when the kidney fails to perform its function. So before we talk about that, let's talk about the functions of the kidney. We talk about the functions of the kidney before we talk about the abnormalities or when the kidney fails. So now, what are the functions of the kidney? So the first function of the kidney is excretory function. So the kidney has an excretory function, which is to remove waste products such as urea, creatinine, and other toxins in blood. So the kidney performs a major role in removing toxic metabolic waste products in the bloodstream through the formation of urine. The kidney also performs a function of electrolyte balance, that is regulation of essential electrolytes like sodium, potassium, and calcium. So the kidney is going to maintain the balance between electrolytes. So the excretion of sodium, the excretion of potassium and calcium. That's why you're going to find that if at all an individual has a lot of sodium in the body, they may be having edema, because a lot of fluids will be shifting from different compartments to the other compartments. So the kidney makes sure that there is a balance in these electrolytes, sodium, potassium, and calcium. Then we also have the function of regulatory function or regulation function. So the kidney performs the function of fluid balance, maintaining fluids in the body and adjusting of urine production. You need to understand urine production depends on the amount of fluids that is found in the body or that is in the body. If there is a lot of fluids in the body, you'll find that urine production will also be high. But if there is reduced amount of fluids in the body, you'll find that urine production as well will be low. So now, what other functions does the kidney perform? So the kidney also performs the function of blood pressure regulation. Blood pressure regulation. But how does it do that? It is by controlling blood pressure through the renin, angiotensin, aldosterone system. So the activation of the RAS, which is the renin, angiotensin, aldosterone system, is how the kidney performs the function of regulation of blood pressure. If you do remember what we talked about in the anatomy and physiology under the renin, angiotensin, aldosterone system, we said angiotensin will be converted to angiotensin 2, that is a vasoconstrictor, causing the blood vessels to reduce in lumen. Again, aldosterone hormone will be released, that will cause now sodium and water retention in a reduced lumen, that will cause now an increase in blood pressure, hence leading to what? Hypertension. So the kidney performs the function of what? Regulation of what? Blood pressure. If there is reduced amount of blood that is going to the kidney, the RAS will be activated, and you find that an individual may have hypertension. The other function includes pH balance, which is potential hydrogen balance. So regulating the body's acid-base balance by adjusting the excretion of hydrogen ions. So the kidney also performs the function of making sure that there is acid-base balance. There should be that balance between the acids and the alkaline. The other function includes the endocrine function. So not only does the urinary system performs its own function as the urinary system, but also other functions of the endocrine system. So the endocrine function of the urinary system or the kidneys is to perform or to promote erythropoietin production. So erythropoietin is the hormone that is responsible for stimulation of blood cells that start to produce blood. So erythropoietin is a hormone that stimulates the blood cells to start producing what? Blood cells. So the kidneys also perform that function. So if at all the kidney has failed, you'll find that all these functions will be suppressed. The other function may be vitamin D activation, that is to promote calcium absorption and bone health. So the kidneys also perform the function of activation of vitamin D that promotes calcium absorption and also keeping the bones healthy. If the kidney fails, these will be altered as well. The other function may be glucose regulation and amino acid regulation. In cases where we have a lot of glucose in the body, you find it has to be excreted. Some of them has to be excreted. So all these are the functions of the kidney. Hence, if there is an impairment in these functions of the kidney, you find that the body will fail to perform or to work accordingly. That's why we say if someone has kidney failure, the whole body will be affected because the urinary system is connected with other systems. So now, let's look at the specific objectives. So we will define renal failure. We explain the three classification of causes of acute renal failure. We describe the pathophysiology of acute renal failure. We explain the phases of acute renal failure. We state the signs and symptoms of acute renal failure. We describe the management of acute renal failure, and we outline the complications of acute renal failure. And by that, we are going to say we are done with the renal failure. So now, by definition, what is renal failure? So renal failure is the inability of the kidneys to excrete waste materials, concentrated urine, and conserve electrolytes, which leads to buildup of waste products and toxins in the body that is characterized by reduced glomerular filtration rate and electrolyte balance. So that's a definition for renal failure. The kidney fails to perform their functions of excreting toxic metabolic waste products. That leads to now accumulation of these toxins in the body. That leads to accumulation of these fluids in the body that will now cause someone to be having the edema, and then it will lead towards a reduced glomerular filtration rate and the electrolytes imbalance. So that is the renal failure. Renal failure. So now we go to the second objective, which we are saying what could be the causes of renal failure. What could be the causes of renal failure? So the causes of renal failure, we have to understand to say they are in three phases. They are in three phases, of which we've got pre-renal causes, outside the kidneys, pre-renal causes. Then we've got, under the pre-renal causes, we've got these factors such as reduction in renal blood flow. So this may be due to fluid depletion in the circulation, as in the cases of shock, burns, hemorrhage, or trauma. So you find that if at all there is a reduction in the blood supply to the kidney, if there is a reduction in the blood flow to the kidney, you find that it may lead to renal failure. What are these things that may cause blood supply to the kidney to become low? So if you talk about in shock, you talk about burns, talk about hemorrhage, someone lost a lot of blood, you find that even the blood supply will be what? Will reduce. Because to talk about the cases of postpartum hemorrhage, you find that someone who had postpartum hemorrhage is going to have a reduced urine output because of what? Because of the blood that is going to the kidneys is of low amount. So hence, someone may have kidney failure. So when there is reduced fluid or blood in the circulation, there will be little blood flowing to the kidneys, and this will result into kidneys forming little urine. So like I said, the amount of urine that is being produced by the body is determined by the amount of blood that is in the circulation. Is determined by the amount of fluid that is in the circulation. If at all there is reduced circulatory volume, you're going to see to it that there will be reduced urine output. So now, the other causes of renal failure may be impaired cardiac performance. Impaired cardiac performance. For example, if an individual has congestive cardiac failure, or we just say heart failure, you'll find that there is a reduction of cardiac output. So the cardiac output will reduce, hence the blood that is leaving the heart going to supply these other organs is little in amount. Specifically the one going to the kidneys, you're going to find that there will be a reduction in the cardiac output. Hence the blood that will be going to the kidneys will be very little, and hence that will lead to what? It will lead to kidney failure. The other causes that are falling under pre-renal causes includes renal vesicular obstructions. Renal vesicular obstructions. So if at all there is those blood vessels that we talked about at first that you saw, if at all there is obstruction in those blood vessels that are carrying blood to the kidney, you are going to find that there will be a reduction in the blood supply to the kidney, and hence it may cause an impairment in the flow of blood to that kidney, hence leading to renal impairment or renal failure. So due to thrombosis of renal arteries, bilateral renal venous thrombosis, and the embolism, if there is a clot in the blood vessels, specifically the renal vessels, the arteries that are carrying blood to the kidney, you find that there will be renal failure. The kidneys will fail to form urine and do other specific functions as it is mandated to do. We go to the second cause, which is intrarenal causes. So under the intrarenal causes, we focus inside the kidneys. Prerenal causes, we said before the kidney, outside the kidney. So now, intrarenal causes stands as inside the kidneys. Those things that are inside the kidneys that may cause someone to have a kidney that has failed to perform those functions that we talked about. So now, the first thing that we're going to talk about under the intrarenal causes is nephrotic drugs. Nephrotoxic drugs. Nephrotoxic drugs. So if at all there is drug toxicity, you find that it is going to impair the structure of the glomerulus, and hence causing it to damage and leading to renal failure. The examples of drugs that you are given is sulfonamides. So with prolonged use of sulfonamides and non-steroidal anti-inflammatory drugs can cause damage to the kidney. So these drugs, the NSAIDs, the sulfonamides, these drugs may lead to what? A kidney damage. The tissues of the kidney may be damaged, leading to renal failure, leading to the kidney to fail to perform its function. What other causes are falling under intrarenal cause? We've got what? Stones in the ureters. Stones in the ureters. So if at all there is the presence of urine stones, there are stones in those ureters, you'll find that it may also lead to what? To kidney failure. So when the ureters are blocked by the stones, urine will start flowing back to the nephrons, causing hydronephrosis and eventually complete damage of the kidneys. So those stones that may be found in the ureters, as you know, the ureters are the ones that connect that comes from the kidneys going to the urinary bladder. So if at all they are ureters, there are stones in the ureters, you find that they are going to cause an obstruction in the flow of urine, and hence causing an accumulation of urine in the ureters, that is going to now start going back to the kidneys, leading to hydronephrosis and later leads to kidney damage. So these causes are falling under intrarenal causes. Other things may include acute infections. So acute infections may be infections of the kidney, that is glomerulonephritis, where there will be an inflammation of the glomerulus. You find that will also lead to what? Renal failure, because the healing of the inflammatory process on the glomerulus will be by scar formation, and hence it will impair other functions of the kidney. The other things includes direct trauma to the kidney. So if you understand intrarenal causes, we're just talking about now inside the kidney itself being affected. So now if you talk about direct trauma to the kidney, if at all the kidney has been traumatized, it may be in an accident, you may find that it may fail to perform its function. So this will cause the kidney to fail to function properly. The other causes may be mismatched blood in cases of blood transfusion. So there will be antigen antibody reaction, which will result in inflammatory reaction and then later leads to what? Kidney damage. So if at all you receive blood from a blood group that does not belong to you, you may find that there will be that antigen antibody reaction between the blood. So that will lead to what? Damage or inflammation of the kidneys and hence leading to what? Renal failure. You have to understand to say the glomerulus, the formation of the glomerulus, it is just the blood vessels that are there. So which means all the blood that surrounds or that goes round into the body passes through the kidneys, and hence these things are going to happen. Away from that, we now talk about post-renal causes. Post-renal causes. So the first one under the post-renal causes may be kidney stones. So kidney stones may lead to what? Obstruction of urine outflow. So post-renal causes are those causes that are going to obstruct the urine outflow, hence leading to what? Urinary backflow. So these are the things that we are talking about. Things that may lead to what? Obstruction of urine from the kidneys out to the outside parts. So the first thing we have is kidney stones. So if there are kidney stones, they are going to impair the flow of urine to the outside parts, hence leading to what? Accumulation of urine and hence leading to kidney failure. The other thing is bladder obstruction. So if there is an obstruction in the bladder, it may also lead to what? Obstruction in urine flow, hence leading to what? To renal failure. Prostate enlargement. Prostate enlargement. In cases of BPH, benign prostate hyperplasia, you're going to find that there will be an impairment or there will be an obstruction to the urethra, hence to the bladder as well. There will be some compression, hence you'll find that there will be backflow of urine going back into the ureters. That will lead to what? Hydronephrosis. All those things may lead to renal failure. Then we have urethral obstruction. So if the urethra is obstructed also, you'll find that the urine output or the flow of urine will be impaired, hence leading to renal failure. So note that all these will lead to retention of urine in the bladder and the kidneys, that will lead to what? Damage. So all the post-renal causes will just cause obstructions, will just cause retention of urine in the bladder and the kidneys, that will later lead to what? Kidney failure. So these are the important things that we are supposed to understand. So when you're asked to write the causes of renal failure, you start with pre-renal causes, then you go to intrarenal causes, after that you go to post-renal causes with the things that are leading to the causes of renal failure, then you get the marks. So from here we look at the next objective, which is the pathophysiology. So understanding the pathophysiology requires us to know the initiation factors or the initiating factors, things that may lead to renal failure. What things are involved in renal failure? Then we are going to have the pathophysiology that is going to give us a satisfactory. That is going to give us the manifestations of those signs and symptoms that we want. So the first thing that we look at is what? The initiating factors of renal failure. So we've got ischemia. So ischemia is just reduced blood flow to the kidneys, often due to what? Hypotension, cardiac failure, or vesicular obstruction. If you remember what we talked about under the pre-renal causes, where we talked about reduced amount of blood flow to the kidneys. So ischemia, standing as a first, it can be an initiating factor to renal failure. So if there is a reduction in blood flow to the kidney, it may lead to what? Renal failure. The other thing is nephrotoxins. So under the pathophysiology, we are just talking about those things that may initiate kidney failure, and those things we're talking about are just what? The causes. Nephrotoxins, exposure to substances that can damage the kidneys. Infection, sepsis, that can affect the kidney, such as glomerulonephritis, the inflammation of the glomerulus. Obstruction, also blockage of the urinary tract. These factors stand as initiating factors of renal failure. So now let's look at how they are going to cause the kidney to fail. So renal vesicular or renal vasoconstriction leads to reduced blood flow to the kidney, leading to ischemia. So if at all there is a constriction of the renal blood vessel, or the blood vessel that carries blood to the kidneys, you find that there will be what? Ischemia, reduced blood flow to the kidney. Tubular injury, this damages the renal tubules, impairing the ability of absorption and excreting substances. So if there is ischemia due to that constriction, you'll find that the tubules of the kidneys are going to be what? Are going to be damaged. And these tubules we are talking about are the proximal convoluted tubules and distal convoluted tubules that plays a major role in reabsorption. So if at all these tubules are damaged, you are going to find that the absorption and excretion of substances will be what? Will be impaired. You'll find that glucose is supposed to be what? Supposed to be absorbed in the body, but due to impairment or damage of the tubules that's supposed to transport the glucose, it will be found in what? In urine. Proteins that are supposed to be found in the body, you find them in urine because the absorption rate has been impaired. Inflammatory responses also leads to activation of the inflammatory cells and the mediators, leading to tissue damage and dysfunction. So the inflammatory process as well will lead to what? Damaging of this tissue of the kidneys, hence leading to the kidney now to start failing into performing those functions. Tissue necrosis. So there will be necrosis of the tissues. Cells of the kidneys will die up and cell lysis follows up, leading to the tissue damage or kidney damage. Then disruption of the glomerular filtration barrier, damage to the capillaries, leading to impaired filtration and the proteinuria. So those kidney glomerulus, the capillaries that are forming the glomerulus there, you find that there will also be damage there. And then if that happens, you're going to find that there will be impaired filtration. There will be impaired filtration. If you remember, under the urinary system, the formation of urine, there is simple filtration where smaller substances are the ones that are able to pass the glomerulus that are filtered. But if at all there is impaired, you find that filtration will not take place adequately. It may lead to what? Not being filtrated, or other substances also passing in instead of being filtrated. So all these factors that we've talked about are going to lead to what? Renal failure, and then leads to the manifestations of the following signs and symptoms, which will be edema. Edema will come in as a result of that obstruction of the urine flow and causing that retention. It may also come in as a result of what? Sodium in the body is what? There's a lot of sodium in the body, in the tissues, hence leading to what? Accumulation of fluids in those tissues, because of where there is sodium, there is also an increase in the amount of what? Fluids. There will be oliguria, which is the reduced amount of urine, or reduced production of what? Urine. This is coming in as a result of what? There is reduced glomerular filtration rate in cases whereby there is reduced blood flow to the kidneys. Hence, the urine formation will reduce and also lead to what? Oliguria. And in some cases, there may be anuria, which is the absence of urine. And also there may be what? Hypertension. When there is a reduction in the blood flow to the kidneys, there is an activation of the RAS, which is the renin-angiotensin-aldosterone system, that causes now vasoconstriction and the retention of water and sodium, leading to hypertension. So all these signs and symptoms will come in and will manifest as a result of what we are talking about. So that is our pathophysiology. So for the pathophysiology, just understand the initiating factors, just understand the causes. If those things happen, what is going to happen? You find that there is an impairment in the flow, there is an impairment in the tubules which are responsible for absorption, there is an impairment in the outflow, there is obstruction. All those things coming together, they lead to damage of the kidney and leading to the manifestations of those signs and symptoms. So this is acute renal failure that we are discussing. So now let's talk about the phases of acute renal failure. So renal failure has got phases, which are initial phase. There's initial phase that just begins immediately the condition starts, but there won't be any manifestations of signs and symptoms. There won't be any manifestation of signs and symptoms, and this one, it may just be for some hours or even a day. So initiating phase or initial phase under the phases of acute renal failure, we are saying this is the first phase, and this begins at the time when the problem starts and continues as the signs and symptoms become apparent or significant. It can last for hours to days. So this is the first phase that we are going to have in renal failure, acute renal failure. Understand, there won't be any manifestations of signs and symptoms. The second phase is oliguric phase. So oliguric phase or oliguria is the reduced amount of urine output. So the second phase after initial phase will be oliguric phase, where there will be reduction in the amount of urine that is being produced. So this will follow within 1 day of the onset, and the duration it depends upon the type of the toxins, injury, and the duration of ischemia. So now, oliguric phase, you need to understand to say what will determine its duration is the extent of the toxins, the extent of the ischemia that is in the kidneys. So if at all there is reduction of blood supply to the kidney for a long period of time, there is also a duration that will prolong in terms of urine production. So urine production will reduce for a long period of time. So the major problem in this phase are inability to excrete fluid loads, regulate electrolytes, and excrete metabolic waste products. So waste products may be there, but they won't be what? They won't be excreted. That is under oliguric phase. So that is oliguric phase. So now we talk about the other things that are going to be included in the oliguric phase that are going to be there or present. So there will be uremic symptoms that first appear when the urine output is less than 400 mils in 24 hours. So you'll find that the urine output will be less than 400 mils in 24 hours, and as a result of increased serum urea nitrogen and the creatinine, which is what the urine output will reduce, and then you're also going to find that there will be increased serum urea nitrogen and the creatinine. So in cases, the most common cases you find, maybe someone had PPH, you find that this you'll be able to see the oliguric phase, whereby the urine output will be retarded or it will reduce. So the urine output will reduce in 24 hours. So that is due to what? The ischemia to the what? To the kidneys. The other things we're talking about is BUN, which is the bilirubin, acid, and nitric acid. They may increase to 20 milligrams per deciliter in a day, whereas serum creatinine rises but at least 0.5 milligrams per deciliter in a day. So you find that also the BUN will also increase. The BUN also increase, but also the urine output will be reduced. So the main apparent or prominent sign that will be under the oliguric phase is reduction in the urine output that is determined by the duration of the ischemia and toxins to the kidneys. So the symptoms that may also be found in oliguric phase may be nausea, vomiting, drowsiness, confusion, coma, the gastrointestinal bleeding, and also pericarditis. So later, life-threatening conditions such as hyperkalemia occurs when urine output is less than 30 mils in 24 hours because of inability to regulate electrolytes. So hyperkalemia, you find that it will be there will be increased amount of potassium, and we know the functions of the potassium is to make sure that there is controlling of the nerves or nerve impulses, and also in making sure that there is support or making the nerves or the muscles not to be very excitable. So if at all there is hyperkalemia, think of the functions of the potassium, and if at all the levels of potassium in the body increases, what is going to happen? So excitability of the nerves will come in. So fluid overload also occurs, resulting in what? Dysrhythmias. Dysrhythmias, where you find that there will be abdominal heartbeats or rhythms in the heart, We'll also have Kuzmo respirations that are going to be deep respirations as well. There will also be congestive cardiac failure, pulmonary edema, neck vein distension with bowing, pulse and hypertension, fatigue and bleeding. All these things will come in under oliguric phase. So when you're asked to write the signs and symptoms, you can pick either from oliguric phase, diuretic phase, and the recovery phase. So the third phase under the phases of acute renal failure is diuretic phase. Diuretic, just from the word diuretic, there is the diuresis, which is the reproduction of urine will be more like, will be high, will increase. So diuretic phase begins with a gradual increase in daily urine output of 1 to 3 liters per day. If you remember, in oliguric phase, the urine output was less than 400 in a day, but in diuretic phase, the urine output may be 1 to 3 liters per day. So which means there is an increase in the urine output, and this may reach 3 to 5 days or more per day. So you find that the urine output will now increase. So urine production is increased because of high urea concentration in the glomerular filtrates that causes osmotic diuresis and inability of the tubules to concentrate the urine. So there will be that production of urine that is going to be what? To increase. That is due to what? High concentration or urea concentration in the glomerular filtrate. So that will cause now the urine production to do what? To increase. So this will slowly increase the excretion of metabolic wastes. Hypovolemia will be there. Loss of sodium and potassium and high BUN initially, which gradually returns to the baseline. Symptoms that may fall under this includes urine output of 4 to 5 liters per day, postural hypertension, tachycardia, and also improving mental alertness and activity, weight loss, tasty, dry mucous membrane, and also decreased skin dagger because of there is increased urine output than normal. So urine output will increase, is going to increase, leading to these symptoms that have been mentioned here. So these last for 2 to 6 weeks after onset of oliguria, but the duration varies accordingly. So this phase, diuretic phase, may take for 2 to 6 weeks, which is just a month and 2 weeks. The last phase that we talk about is the recovery phase. The recovery phase where everything or the functioning of the kidney will start getting to be stabilized. So this begins when the glomerular filtration rate increases. So the glomerular filtration rate has started to increase and the normal function of the glomerulus has stabilized, allowing the BUN and the serum creatinine to stabilize and then decreases. So the major improvement that occurs in the first 2 weeks of this phase, but renal function may take up to 12 months to stabilize. The major symptoms is decreased energy levels, which lasts for 3 to 12 months, which is just 3 to 12 months, and that could be an approximate a year, so, or 9 months. So that is recovery phase. Recovery phase. So those phases are the ones that you're supposed to write. 4 phases: initial phase, oliguric phase, diuretic phase, and the recovery phase stands at the phases of acute renal failure. So when we start talking about the signs and symptoms will just be getting from each and every phase that we had, if at all there are signs and symptoms, and you write and put them together. So the first sign that we have is the reduced output of less than 1 ml per hour because of impaired kidney function. So urine output will be reduced. There will be oliguria, or there will be what? Anuria, which may follow due to progress of the disease. Anuria is reduced or absence of what? Urine. So there may be edema that is due to fluid retention as well. There may be weight gain that will be as a result of that edema. There may be uremic frost skin due to excessive urea in blood stream. So those are the functions, or those are the signs and symptoms. So the other signs and symptoms that you can remember, there was drowsiness, there was vomiting, there was nausea, abdominal discomfort. All those things may be under the signs and symptoms, and you can add them. Management of acute renal failure now. So how are we going to manage acute renal failure? So our aims of the management is to treat the underlying cause, because if we treat the underlying cause, we are going to stop what? The condition. To manage the complications as well, to provide supportive therapy within the constraints improved by the what? Renal failure. So under your aims, every time consider writing the aims that are going to match with what you're going to be doing. Never write the aims that are contrary with what you're going to be doing. If you say to treat the underlying cause, which means there might be some form of treatment or drugs that are going to use to accomplish this aim that you're having. To manage the complications, there might be some measures that you're doing to be managing those complications. To confirm the diagnosis, also being part of the aims. What are you going to do to confirm the diagnosis? The things that you do, the investigations that you do. Then your aims are now what? They are now valid. Not writing aims that are contrary to what you are doing. So we move now. So we talk about the investigations that we do. The first thing that we must focus on is what? History taking that may review the onset of the signs and symptoms or reduced urine output as may be verbalized by the patient. So on clinical presentation of the patient, such as there may be oliguria, anuria, muscle weakness with nausea and the vomiting. All these may be your investigations that you can do to diagnose renal failure. Blood for urea, which will be raised. So blood for urea will be raised as well. Intravenous pyelograms, which is IVP, to visualize the kidneys, and this may review kidney stones or malignancies, which may be tumors. Urinalysis may show a raised levels of proteins. Urinalysis again may show a reduced what? Urine output as well. So all those may be the investigations that you can do. Sometimes you can also do what? FBC. FBC in cases where there's what? There is an infection. So there will be increased white blood cell levels in blood. Then you can also do a cystoscopy, that is just to visualize the bladder to review if there are any stones that are causing obstructions and leading to what? Backflow of urine, leading to hydronephrosis. We can do a renal biopsy, which may review malignancies, urine microscopy, culture sensitivity to isolate the causative organism, and for specific antibiotics. So we can do all these investigations just to confirm the diagnosis of renal failure. We go to the treatment. How are you going to treat renal failure? The first thing that you are going to focus on is what? That there is reduced urine output, there is edema. So that edema that we had to see, how are we going to manage the edema? So that edema will be managed by what? We are going to use a class of drug known as what? Diuretics. A class of drug known as what? Diuretics. So in instances where the patient has adequate hydration and had no lower tract obstruction, diuretics such as furosemide 1 to 2 milligrams per kg body weight, that is TDS, may be given. Mannitol as well, 0.25 may be given as well. And they may be administered rapidly to provoke the flow of what? Urine. So this is just to promote the flow of what? Urine. Because if toxins keeps on accumulating in the body, it becomes a problem. So diuretics are what we are going to use at pace. So mannitol also helps to dilate or dilute any nephrotoxins that may be present in the tubules below the toxic level. So mannitol, when administered, is going to cause that dilution of those toxins, and hence will reduce on the effects on the kidneys. Intravenous fluids such as normal saline and as well, or blood transfusion to replace the circulatory volume that contains waste products and toxins may be what? May be needed or may be required. Calcium gluconate as well. Calcium gluconate 0.5 milligrams per kg IV slowly over 2 to 4 hours to help control hypocalcemia and to stabilize the membranes. Sodium bicarbonate, all these drugs may be given just to elevate the serum pH to cause a transient shift of extracellular fluids of potassium into the intracellular fluids. Glucose 50% and insulin 1 unit IV will accelerate the glycogen synthesis, thereby causing glucose and potassium to move into the cell. So if you give glucose 50% and also insulin 1 unit, it is going to cause that increased amount of glucose that is in the body. It will now be initiated or into the blood cells. So glycogen synthesis will be increased, and hence you find that there will be shifting of the glucose that is in the blood into the cells, where someone may even have some energy because the glucose has started working. The waste management that we give, or we can say the only permanent that you can give, is what? The dialysis. So dialysis in cases of chronic renal failure, where the kidney fails completely, or the kidney has failed, is damaged completely, the person needs what? Dialysis. And this is to help remove waste and correct fluid and electrolyte balance, either by exchange of blood transfusion or by use of intravenous fluids such as normal saline. So you need to understand, if someone is on dialysis, which means they will be the machine will be helping them in excretion of this substance, and this is for life, and it is the worst that someone can expect. It is every day. So what could be our complications and the management of these complications? So hyperkalemia, which is increased potassium levels, isn't it? So because of the kidneys are impaired and cannot filter extra potassium from the blood or remove it from the body, excess potassium from the diet also contributes to increased levels in the blood, especially if there is kidney malfunction. So the first complication that will be there will be what? Hyperkalemia. So that hyperkalemia, how are we going to manage hyperkalemia? So the management is here. So hyperkalemia can be minimized and sometimes avoided by giving the patient food rich in low levels of what? Potassium. So it can also be minimized through the peritoneal or hemodialysis. All those things, they can be used to manage hyperkalemia. So as you are giving food to this patient, there must be a reduction in potassium intake because of the one that have been increased. Hypertension is a complication of renal failure. So this is due to overexpansion of extracellular fluids and plasma volume together with activation of the RAS, which is the renin-angiotensin-aldosterone system. How are you going to manage hypertension? With the use of antihypertensive agents. So hypertension can be controlled with antihypertensive drugs and by limiting fluids and salt intake. That is how you are going to manage hypertension. The other complication will be anemia. So anemia is related to high levels of urea and oliguria. So levels of urea shortens the lifespan of red blood cells in the body. So if there is an increase in the levels of urea in the blood, you find that the lifespan will do what? Will be reduced, and hence the destruction of the red blood cell will do what? Will be high, and that's when you find that there will be somewhat bilirubin levels that are going to be high. Like we said, there will be BUN will increase. So restricted protein intake in acute renal failure also contributes towards anemia. So in this case whereby proteins intake are being restricted, you may find that also anemia may come in. So how are we going to manage anemia? So anemia can be managed through blood transfusion if the HB is below 6 grams per deciliter. Seizures may also come in as a result of what? From uremia, and also related to hypertension, hypernatremia, and also hypocalcemia. So low levels of sodium, low levels of calcium may lead to what? To seizures. So the treatment will be what? Will use anti-epileptic drugs. Anti-epileptic drugs are the ones that you can give. We can also have cardiac failure, heart failure. How are we going to manage heart failure? So the treatment is directed towards reduction of fluid volume with water and sodium restrictions and administration of diuretics. That's how we are going to manage. So this is acute renal failure, and if the question comes, this is how you're supposed to manage. So the reason of me making these presentations like this is for you to be seeing whatever I'm talking about. Some people believe in what they want to be seeing what someone is saying. So this is the main reason for me doing or making these presentations like this. So for now, I can say you are ready for cardiac you are ready to answer the renal failure, that is acute. So for chronic, if you start talking about chronic renal failure, just consider repeated renal failure or episodes of acute renal failure leading to what? Chronic renal failure, and the only treatment that you are going to give to this patient will be dialysis for life. So repetitive reoccurrence of acute renal failure leads to what? Chronic renal failure. This is Renal Code. Thank you.